Can a lady, a woman, female, visit a gynaecologist to be examined during this month, Ramadan?
For a lady to visit a gynecologist while she is fasting, it's not prohibited. But she should take care that the gynecologist she visits should be a lady, because we have to maintain the hijab. It is not advisable, or it's rather haram, that she goes to a Jain gynecologist. Unless there is no one in that area and she has such a disease which may take her life, or it's a serious case, then if she doesn't find a lady gynecologist and she goes to a Jain gynecologist, it can be excused as a last resort. But normally she should visit a lady gynecologist. Now when she visits a gynecologist, if an examination is done, it may be a PV, as we say in our lingo, medical lingo, that per vaginal examination, whether a finger is inserted in the vagina, that will not break the fast. If any instrument is put in the vagina also, it will not break any fast. For any testing, any examination, or if any vaginal pessary is also put in the vagina, that will not break the fast. While she goes to a gynecologist, if there are any other tests done, or if any instrument is put in the uterus, any intrauterine device, or any catheter is put, all these things will not break the fast. Furthermore, if while the gynecologist examines her, and if any testing has to be done, any tube or catheter has to be put in the urethra, that is urinary passage, all these things will not break the fast, because it does not constitute that food or nourishment is being reached. And food and nourishment cannot be given through the vagina, through the urethra, through the uterus. So the scholars are unanimous, agree that she can visit a gynecologist, she can get herself examined. This will not break the fast at all.